Dove International Mental Health Hospital has the headquarters in Kenya with several branches in different counties with the aim of reducing mental health burden nationally and across the globe in providing in- and outpatient services.
We have a very serene environment. The environment is quite accommodative to enable our patients just to start coming back to their normal senses. It's very important in terms of treatment, the peace and tranquility that is required. We also have spacious rooms where we accommodate our patients. Most of our patients have their own spaces to live in, and some are shared rooms. We have 2 patients per room. We have an exclusive aside quarters for men and also for women. They do not live in the same residence. We have different rooms where they're able to have their own space so that they can be able to have a perception or understanding of their own self-awareness, because back in addiction there's what we call defects of character or maladaptive characteristics, where there is a lot of dishonesty, there's a lot of manipulation and all those things. So it will not be healthy for us to have them living within the same residence. And because of that also, we make sure that we have optimum security. We have surveillance, we have men on the ground just to make sure that everything is in order. And for the sake of our patients not being able to become mischievous and make an exit before discharge.
Dove so far stands as a leader in providing growth in mental health through holistic management and recovery by offering all levels of care in our treatment continuum. We have a qualified team comprised of senior and well-experienced psychiatrists, neuropsychiatrists, medical officers, clinical psychologists, psychiatric nurses, general nurses, psychologists, addiction specialists, trauma specialists, marriage and family specialists, child and adolescent specialists, spiritual therapists who take pride in bringing our patients the highest standard of truly customized care.
And we also have a common lounge area where they get to go and relax and watch their movies for recreational activities. We also have a dining space. We also have different rooms where we conduct our therapies. We have different games in terms of outdoor activities. We also have board games. And in terms of socialization, we get to have group activities also, whereby they can have different games that they get to play, like over the weekends. They organize for their own tournaments and they're able to achieve much in terms of that. The other thing that we look at from the clinical department is we ensure that our patients get to have a mental status examination on a daily basis, just to be able to gauge and rate where they are in terms of progress, because this is very important.
We view each patient as an individual and offer a unique variety of therapy and treatment programs to engage patients of various backgrounds, demographics, and life experiences.
The menu is good, and the moment someone has gone through the detoxification process, their appetite bounces back. So you may see someone looking all nice and healthy, and then you think this person really is recovering. But it's very important for us to have a medical assessment in terms of the mental status examinations and comprehensive psychotherapy sessions. We also have classes. We major on the CBT, a modality of treatment. We also incorporate what we call the 12 steps Minnesota model of treatment, where we talk of powerlessness, where we talk of coming to believe, where we talk about spiritual principles, because addiction actually requires some sense or essence of spiritual awakening. Not just the medical part of it, and that's why we are really passionate and holistic about our program, but also on the medical part of it, we are quite big, just to ensure that these people actually have full insight before we think of moving forwards in regards to their discharge plans.
All of our programs and therapies are designed to treat a person's whole mind, body, and spirit. We prepare our patients for a successful transition back into society. We instill a healthy level of self-sufficiency while giving support to our patients each step of the way. We assist in post-treatment employment services, ongoing legal issues, continuing education, community service opportunities, and provide life skill coaching and comprehensive program on relapse prevention programs and trainings.
Our family also is very important, and when we have our what we call family therapy sessions is we invite family to come, so we are able to psychoeducate them on different mental challenges, on the nature of addiction as a disease, so that they may get to understand that our patients don't just have it's not a moral issue, it's less of a discipline problem and more of a medical problem. So here at Karen, we are very passionate about that, and by the time we are letting go of our patients, we still emphasize that these people need support for a long time, but we really are passionate about that.
DAV is fully accredited with the National Hospital Insurance Fund and the other health-related insurance that is meant to reduce the financial burden to the vulnerable community who are seeking for services but cannot manage. We have a very able rescue team 24/7 who are well equipped clinically to support the community. DAV has the best statistics and rated well in the success rate and emerging to be the best facility in management of mental health related complications and relapse prevention management. We are working in partnership with other neighboring hospitals and referrals with the aim of reducing mental health related burden. DAV was launched in Kenya with its branches in Karen Town and Kikuyu region, Kiambu area and many other branches, and was created to raise the recovery potential for clients of all backgrounds in a nurturing, supportive setting. There is hope for anyone struggling with substance abuse and mental health related complication. A small client-to-therapist ratio ensures the highest quality of care possible. A safe environment where clients are taught how to effectively deal with everyday challenges, including past failed attempts at discovering solutions, can help you toward recovery. Therapists and counselors utilize a variety of treatment modalities in order to provide clients with the tools they need to achieve long-term sobriety. By understanding each client's unique differences, clinicians tailor individual treatment programs to achieve the highest level of wellness on the road to recovery.